A Vancouver Island MLA is proposing legislation to force the province to disclose growing wait times for seniors' care homes. For more, let's check in with Rob Shaw at the BC Legislature. Rob, tell us more about this. What's the idea here?
Well, Stacey, Courtney Comox's MLA Brennan Day is proposing a bill here that would require the government to publish the latest wait times for long-term care beds, which are mostly shrouded in mystery depending on where you live in the province. Day has tabled in the legislature the Long-Term Access and Transparency Act, which would make public the time it takes to get a long-term care bed, as well as a hospice bed and even home care supports, plus a number of people who die on the wait list. The health minister would be required to produce monthly reports as well as a detailed annual report on the trends and what actions are being taken to bring those waits down. All of this occurring amidst the backdrop of a seniors population that is growing much faster than the government is building long-term care beds.
But realistically, the majority of this data is already collected. All this is asking for is to publish it so that it gets in front of you find people in the media more than once every 18 months, because that's not good enough. We cannot fix what we don't measure, and right now in British Columbia, we're unfortunately falling further and further behind every year, and without a clear plan and some public pressure, we're going to be in a hell of a deficit going forward in this province for long-term care and seniors.
Island Health says it's actually brought seniors' wait times down to an average of 160 days for the first offer of a bed, a 27% reduction year over year. It depends on the facility, though, and if you actually want that first offer for a bed. Here's why the wait times are concerning. The gap in long-term care beds over the next 5 years, the government plans to build around 3,000 beds per year, though in the last budget they parked 1,200 beds because they are too expensive. They're going to need at least another 5,000 beds there to close that gap, according to the seniors advocate. So, Stacey, unfortunately, it's unlikely that this is going to pass, partly because it's a private member's bill from a Conservative MLA, but also because the government doesn't want monthly reports showing that in some parts of the province things are not getting better, or not getting better as quickly as the government might want you to believe. Right now, there is not a lot of clear data out there, but we'll see if the government moves at all because of the pressure caused by this MLA's bill.